Hello, my name is Scott. This is my head to toe assessment. I'm going to begin by walking in the room. Walking in the room, I'll go wash my hands. All right. Hello, my name is Scott. I'm an FNP student. I'll be doing a head to toe assessment on you today. Can we get started by you stating your first and last name?
Myra Centeno.
And what month are we in, Myra?
We are in the month of June.
June, okay. And what year are we in?
2020.
And where are you at right now?
At the doctor's office.
All right. So, general appearance is Myra is a pleasant Hispanic female, well dressed, well groomed. She's alert and ready times 3. Speech is coherent, and we'll begin I'm gonna begin by asking you a few questions before we get started. Are you in any pain right now today?
No.
No, okay. Now, during this head to toe assessment, I'm gonna be palpating and listening to different areas of your body. Is that okay?
No.
What I want you to do is let me know if you have any pain or if you're uncomfortable or you have any questions while we're doing it, okay? All right. So first thing I'm gonna do is start by looking at your head. And then I'm gonna palpate your head, okay? Any pain when I do this?
No pain.
All right. So the head is erect midline. Skull is atraumatic normocephalic. Skin, the hair is evenly distributed throughout. There's no signs of alopecia or any lesions. And then now we're gonna go to your face. Your facial features are symmetrical on both sides. Let me know if this hurts. Any of this stuff hurts, okay? Any of that hurts?
No.
All right. So patient non-tender on palpation of the facial bones. She has full eyebrows. Her lashes are on the upper and lower of the eyelid, pointing up, which is normal for the patient. Her eyelids are symmetrical on both sides. Can you do me a favor? Look up for me. Conjunctiva is nice and pink, clear, no signs of subconjunctional hemorrhages. The sclera is nice and white. The cornea is clear. The irises are brown bilaterally. Tell me, does this cause you any pain?
No pain.
Lacrimal apparatus is normal without any tenderness. No ptosis as well on the eyelids, no drainage. And now what I'm gonna do is just kind of do a quick little test just to test your field of vision, okay? So what I want you to do is cover one eye, whichever one, all right? And then let me know when you see.
I see it.
All right.
Yes. Yes. Yes.
Without, look at me.
Yes. Yes.
All right, good. So field of vision is intact. Right now I'm going to look into your eyes, okay? First thing I want you to do is just look straight ahead at me, okay? You don't have to do anything special. All right, so. All right. All right, just kind of look straight ahead for me. All right, can you follow this finger? Good. All right, now I'm gonna look at a few other things. Pupils are equal, round, reactive, and accommodating the light. I'm gonna do a eye exam on you. So what that means is I'm gonna kind of get close to you, okay? I am gonna put my hand kind of on your forehead just so we don't bump heads, okay? The only thing you have to do is again look straight ahead, pick an object to look at, okay? All right. All right, go ahead and look straight ahead for me. All right. Now we're gonna look over here. Just continue to look straight ahead for me. Good. Red right. red light reflex, good corneal reflex in both eyes. All right, just keep looking straight ahead. Just look in your eye. All right. Optic disc in both eyes are creamy in color, sharp margins, no blurred, no hemorrhages, no AV nicking. The arterial to venous is 3 to 5. There's also no optic cupping, and the lens is clear, no cloudiness seen in the lens, which kind of rules out glaucoma and cataracts, okay?
Okay.
All right, next, we're gonna move on to the ears, okay? You had any problems hearing recently, any hearing changes? Okay, so, and as far as face, skin's warm, dry, and intact, no breakdown, no lesions noted. The ear, I'm gonna pull your hair back a little bit, okay? All right, so the ears are even with the outer canthus of the eye, which is normal. I am gonna palpate your ears, okay? Dorica, and any pain right here?
No.
No, all right. So no pain upon non-tender on palpation. From here is I'm going to look inside the ear, okay?
Okay.
Basically, the way we do this is I'm gonna pull your ear up and back and just kind of insert it in and kind of look, okay?
Okay.
All right. All right. The external canal is pink, dry, without drainage. The tympanic membrane is intact. It's a pearly gray color, and I do see a cone a light at 7 o'clock. All right, so I'm gonna look one more time on the other ear. So again, I'm gonna pull the ear up and back, and as I look in, I see a pink, dry, external ear canal without drainage. The tympanic membrane is intact. The cone of light is present and is at 5 o'clock. All right. So as far as the ear exam is completely normal, which is
Okay.
good, okay? All right, so we're gonna move on to your nose, okay?
Okay.
Basically, the nose is symmetrical. There's no obvious deformities. You never broke your nose or had any nasal surgeries, so no surgeries on the nose. Let me know if this hurts. Any of that hurt?
No.
No. All right. So basically, nose is non-tender, and now is what I'm going to do is just get you to kind of do me a favor, cover one nose, inhale. All right, switch to the other nose. Both nares are patent, and now I'm just get you to look up. And when I'm looking in, the nasal mucosa bilaterally is pink and moist. No drainage, no bleeding. Also, the terminates are also pink, moist, and non-draining, and no bleeding noted. All right. So from here, we're gonna move on to your lips and mouth. Lips are symmetrical bilaterally. There is a good distinct margin between the lips and the face. Can you do me a favor? Can you show me your teeth? Good dentition, no broken teeth, no bleeding. Do me a favor, stick out, open your mouth as wide as you can, and we'll just expose your gums. Gums are pink, dry, no lesions noted, and no bleeding. Do me a favor, open your mouth wide for me, stick out your tongue. All right, the soft and hard palate is smooth. No lesions on that. Is warm, dry. No bleeding as well. Mucosa is also pink without any lesions as well. Do me a favor, stick out your yeah, there you go. So the floor of the mouth is normal looking. It's pink, dry, or pink, moist, no drainage, no lesions, okay? I am gonna do this. I'm gonna get you to stick out your tongue as far as you can. Say ah. And right now, the uvula is midline. The oropharynx is pink. No redness noted. No drainage. No lesions. Tonsils were +2 without exudate or without white patches, which is a normal finding for tonsils. And And from here, we will move to your neck. Alright, skins, warm, dry, pink, warm, dry, and intact, no lesions anywhere. Can you swallow for me? Good. Look to your left, look to your right. No JVD noted. I am going to palpate your trachea, which means I'm going to press kind of right here, okay? Let me know if any of this hurts. Trachea is midline, no deviation. And here I'm also going to palpate the thyroid. And basically, all right, feel for the thyroid and the cartilage. Do me a favor, swallow. All right, go ahead and swallow again. All right, the thyroid is not enlarged. There's no nodules, no abnormalities on the thyroid or the cartilage. It does rise and fall with swallowing, which is a normal finding. And from here, I'm gonna palpate your lymph nodes, okay? I'm gonna start from behind your occipital region. Then I'm gonna move on to the post-auricula, the pre-auricula, the tonsillar, the submandibular, the submental, the anterior cervical, the deep cervical, which is kind of hard to feel, and then the post-cervical, and then also the super clavicular, which is right above the collarbone. Any pain with any of that?
No.
No. All right. So none of the lymph nodes are non-tendered. They're not palpable. I felt no nodules, no masses on the lymph nodes as I was palpating them. So basically, it's a normal exam. Do me a favor. Look as far up as you can. Touch your chin to your chest. All right. Look at me. Turn your head all the way to the right, all the way to the left, and make kind of a circle with your head. All right. And now go the other way. All right, patient has full range of motion in her neck, which is a normal finding. From here, we're gonna move on to your back, okay? So can you take off your shirt for me? And from here, I'm just checking out the skin. The skin is pink, warm, dry, and intact, no lesions anywhere. She is not using any accessory muscles, no retraction, as you breathe, no dyspnea noted as well. And what I'm going to do is I'm going to get you to take a deep breath in and out. Deep breath in, deep breath out. All right, so basically that shows a symmetrical chest expansion. And what I'm gonna do is get you, if you can, you wanna sit in this little rolly chair for me? Just so it's easier for them to see. All right, so there we go. Just adjust, there we go, perfect, right there. All right, so at this time, I'm also gonna palpate the eight different areas on the posterior chest. And what I want you to do is say 99 for me, okay?
Okay. 99, 99, 99, 99, 99.
All right, tactus firmus without any vibration, so no consolidation noted. I'm also gonna go ahead and palpate the areas as well, okay? All right, percussion of the posterior wall balance, all no dullness, which is usually a sign of consolidation. Also, do you feel any pain when I do this?
No.
All right, so no CVA tenderness, no signs of kidney infection. At this point, I'm going to listen with the diaphragm of my stethoscope to the 8 fields. And what I want you to do, Myra, is say E for me.
E, 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 E.
All right, so basically, all I heard was E. I heard no muffle sounds through my stethoscope, which shows no consolidation, which is a normal finding as well. Normally, you would hear like kind of an A, which usually signifies that it's some kind of consolidation in the lung fuels. Now, right now, I just want you to take a few deep breaths and continue to do so until I tell you to stop, okay? All right, nice deep breath. Good. Nice deep breath. 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 And nice deep breath. All right, so lung sounds are clear in all eight areas. There's no adventitious lung sounds. There's no wheezing, no rhonchi, no rales. It is a normal finding for the posterior back. And I am right now also going to palpate your spine. Any tenderness or pain when I do this?
No.
Okay, the spine is in its correct alignment. So now we're going to move around to the anterior portion of the chest, okay? You can have a seat back on the bed. Okay. All right, we'll trade up. All right, so on the anterior portion of the chest, skin again is warm, dry, intact, no breakdown anywhere, no lesions noted, and I'm gonna listen to 4 different areas of your chest, okay? One thing I need you to do right now is just take some deep breaths when I tell you to, okay?
Okay.
Okay, deep breath. Deep breath. Deep breath. Deep breath. All right, so lung sounds are clear in all 4 areas of auscultation. No adventitious lung sounds, no rales, no rhonchi, no wheezing. And right now we're gonna move on to the cardiac, which first I'm going to do is palpate each carotid. And what I would do is feel for at least 60 seconds in the carotids. They are regular rate and rhythm. They are +2 bilaterally. And now I'm gonna switch to my bell on my stethoscope and listen for buoys. And no buoys noted on auscultation. Usually if you hear that, it would be a loud, harsh sound. All right, so what I'm gonna do now is feel for your radial pulses. And we'll take off your watch. All right. And again, we're gonna feel for 60 seconds. Radial pulses are equal bilateral. Rate rhythm is a normal rate, normal rhythm, +2 in both radial. Right now, I'm gonna just get you to kind of lean backwards. What I'm feeling for now is the femoral. And again, it's +2 and bilateral femoral. And then we're also gonna feel for posterior popliteal, which sometimes hard to feel when clothes are on. That's why we normally have people dress in a gown only, but for this, we're not gonna do that. So she has good +2 popliteal, posterior popliteal, post tibula pulses. And now I'm gonna feel for dorsalis pedis, and we feel again for about 60 seconds. And she is +2 on her dorsalis pedis pulses, which are all normal findings as far as pulses go. All right, so we're gonna move on to, now I am going to feel and for heaves or thrills, okay? So basically what I'm gonna do is feel different, these 5 precordial areas of your chest, okay?
Okay.
So the only thing you have to do is just breathe normal. I'm gonna go ahead and explain where I'm gonna be touching. We gotta do the aortic area, which is the second intercostal space, right sternal border, the pulmonic, which is the second intercostal space, left sternal border, Erb's point, which is the third intercostal space at the left sternal border, the tricuspid, which is the 4th intercostal space, left sternal border, and then finally the mitral area, which is the fifth intercostal space, left clavicular line. This is also the apex area of the heart and also the pulse of maximum impulse, okay?
Okay.
All right, or maximum pulse of maximum intensity. All right, so let me know if you have any pain here, okay? And again, I'm gonna go ahead and feel for your PMI. I'm also gonna do it while you're laying down because it's a lot easier when you land on your left side. All right, so I feel no heaves, no lifts. And from here, what we're gonna do is I'm gonna oscillate with the bell of the stethoscope and the diaphragm of the stethoscope in those same 5 areas, okay? I'm gonna get you to set up. You can lean slightly forward. Just makes it a little bit easier to hear the sounds. And what I'm gonna be listening for is the lub dub, the S1, S2. S1 is usually heard better under here at the tricuspid and the mitral valve, while the S2 is better heard up here. And then urge point, you kind of hear it all in that area, okay? And what I'm gonna be listening for is just normal heart sounds. All right, now I'm gonna switch to the bell. And the diaphragm, we hear the harsh, the louder abnormal heart sounds, and the bell, we hear the softer ones. So that's what I'm listening for here. All right, so you have good normal S1, S2. There's no extra heart sounds, meaning there's no S3, S4. And usually S3 and S4 is better when you're laying down. So we are gonna lay you down for that as well, which we'll do in just a second. Here we're listening more for the aortic or the pulmonic murmurs, which is like aortic pulmonic stenosis, aortic pulmonic regurgitation, or these abnormal heart sounds that we normally hear if you have a problem with your heart. But yours are clear, so you don't have any of that, okay? And I didn't hear any other clicks or snaps as well, which is good. Those are kind of hard to hear. Again, some of this stuff is easier once we lay you down, which I'm gonna have you do now, okay? Just move your stuff out of the way. All right, so at this time, I am gonna listen to the 5 precordial areas again, starting with the diaphragm of my stethoscope. And again, I'm gonna be listening for 60 seconds in each area to make sure we hear the full systolic and diastolic movement of the heart. This area is better to hear mitral valve and tricuspid valve murmurs, such as the tricuspid insufficiency, mitral valve regurgitation, or tricuspid regurgitation. What I'm also going to get you to do is, if you can, is roll that way to the left side. And again, I'm going to listen with the diaphragm. And then I'm listening with the bell. All right, you can go ahead and lay it on your back. All right, so again, no normal S1, S2, no extra heart sounds noted, no S3, no S4, no heart murmurs, no clicks, no other abnormalities. And then from here, we're gonna move on to your abdomen, okay? First thing I'm gonna do is listen with the diaphragm of my stethoscope to the 4 quadrants, okay? This is not gonna hurt. Basically, you can breathe normal. All I'm listening to is your bowel sounds, okay? Vowel sounds are normoactive in all 4 quadrants. Usually you listen for vowel sounds about 60 seconds, but they are normoactive at this time. From here, I am going to lightly palpate the same 4 quadrants, okay? So let me know if you have any tenderness. Any tenderness? Any tenderness?
No.
Any tenderness? No? Okay. So no tenderness upon light palpation. We are gonna do some deep palpation, which what I'm gonna do is get you to take a deep breath.
Okay.
Go ahead and take a deep breath. Another deep breath. Okay, another deep breath. All right, breathe out, another deep breath. Any tenderness there? I didn't feel any or megaly. There was no obvious signs of organ enlargement. What I am going to do is also take a deep breath for me. All right, you can relax. Another deep breath for me. Any pain when I do that? No pain on that. Not able to palpate the kidneys, the right or the left kidney. Sometimes you can palpate the right kidney, but no enlargement as far as that goes. Also, skin-wise, skin's warm, pink, dry, intact. There's no obvious hernias noted. There's no lesions or abnormalities on the abdomen. I'm also going to go ahead and get you to take a deep breath for me. Any pain there? Murphy's point is negative. Murphy's sign is negative, which is basically to check for cholecystitis. Usually what happens is when you take a deep breath, I press down, you'll have like a pain or a catch there, and you didn't seem like you experienced any of that, correct? All right, so right here, I'm gonna feel for your McBurney's point. Your McBurney's point is between your umbilicus and your iliac crest. So it's about right here, and what we do is press. Any pain there? So a negative McBurney's point is a test for appendicitis. I am going to press here. Any pain when I do that? And with this test, it basically compresses here. It radiates pain over to the right side. So that's how you can tell for the appendicitis as well. And we have 2 other tests for the appendicitis. The next one is I'm going to get you to lift your leg. And this is any pain when you do that in your lower right quadrant?
Nothing.
All right, and that's a psoas, basically muscle that runs right along the appendix. When that's the appendix is big and irritated, when you move that muscle, it'll irritate the appendix and you'll have pain. And you also have the Truster muscle, which I'm gonna bend your leg. And any pain when I do that?
No.
All right, so no pain with that. So that is basically a negative test as well, which is no signs of appendicitis. Also, while I'm here, I'm going to palpate your inguinal lymph nodes. Any pain when I do this? No. All right, so there's no palpable masses or nodes in the inguinal lymph nodes as well. All right, so now I can have you set up again. And here we're going to do the cranial nerve test real quick, okay? So, let's see here. Oh, we'll use this one. All right, close your eyes. Hold one nostril. What do you smell there?
Like fruity.
Okay.
Sweet.
Yeah, sweet. All right. All right. So no abnormality. You can release it. Basically, that the smell test, which usually you can use lemon, garlic, onion. All those different smells. But no changes in smell usually is the way to show that the olfactory cranial nerve is intact. Next, we're gonna move to the optic nerve, which we already kind of tested this once. What I'm gonna do is get you to do this.
Yes. 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 Yes.
All right, that along with the Snelling chart shows that the optic nerve, the optic cranial nerve is intact as well. One other test I am going to do is, it's called the covered uncovered test, so you just look straight ahead, okay? Alright, cover and uncovered test was normal, both pupils, no script business are noted. The next test I'm gonna do is the cardinal gaze, which is I'm gonna get you just to follow my finger with your eyes. We did this earlier, but I'm gonna do it again. This confirms cranial nerves 3, 4, and 6, which is oculomotor, trigeminal, and the abducens, okay? So just follow my finger. Good. Now the stigmas, extraocular muscles are intact, which confirms those cranial nerves 3, 4, and 6. The next is the trigeminal nerve, which is number 5. And this is done, we're gonna do the sensory part of that test first, okay? So what I'm gonna get you to do is close your eyes for me. And you see, this is soft. And then I'm gonna touch different areas of your head and face, and you let me know if you can feel it, okay?
Okay. I feel that. Yeah. 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 Yeah.
All right. Now I'm gonna touch, this is what we consider kind of sharp.
Okay.
And now I'm gonna touch the same areas.
Yeah. 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 Yeah.
All right, so the ophthalmic, the maxillary, and the mandible areas of the branches of the trigeminal nerve are intact. And from here is I'm gonna do a couple of tests on you to confirm the trigeminal. Basically, I want you to clench your teeth, and what I'm feeling is the temporalis muscle and the masseter muscle, which are the part of the motor function of the trigeminal, which is involved in mastication, okay? Also, what I want to do is go ahead and I'm going to check your TMJ joint. So in this, what I want you to do is open your mouth as wide as you can, close. Any pain with that?
No.
So no crepitus on the TMJ as well, and full range of motion. And from here, we are going to do the check your facial nerve, okay? Basically, the check the cranial, facial cranial nerve is I'm gonna get you to do a few things, okay? Can you wrinkle your forehead for me? Good. Can you raise your eyebrows? Good. Can you puff out your cheeks? All right. Can you stick out your tongue? Can you make a big smile for me? Good. So all of these are facial expressions, which the facial cranial nerve is responsible for, and they're all intact, okay? So the next I am going to do is check your next cranial nerve, which is cranial nerve 8, the vestibulocochlear nerve. It's also called the acoustic nerve. Basically, it's your hearing, okay? And you said earlier you had no hearing changes recently, right?
Right.
No, okay. So we're gonna do 3 tests for this, okay? First I'm gonna do is I'm gonna get you to repeat the words and numbers I'm gonna give you, okay?
Okay. 89.
All right, and we'll go to the other side.
31.
All right. So the whisper test, she's able to hear. So basically the next test is the Weber test. And what I'm gonna do is it's gonna vibrate. I'm gonna put it here. You let me know if you hear equally in both ears, one ear better than the other.
It's equal.
Equal, okay. So she has equal lateralization, able to hear it in both ears. Abnormal Weber, you would usually hear more so on one ear or the other. So it's normal to have a little bit of differentiation, like maybe you hear a little bit more in the right ear than the left, but if you hear totally hearing in your right, not hearing in your left, that's an abnormal Weber test, okay? The next one is the Ren test, and basically what I'm gonna do is I'm gonna hit this and put it on your mastoid bone behind your ear.
Okay.
You let me know when you can't hear it anymore.
Okay, I can hear you.
All right, can you still hear it?
Yeah.
All right, so we're gonna do the other side.
I can hear you.
Can you hear it now?
Yeah.
All right. She had a positive RIN test, which is normal. Basically, air conduction is 2-to-1 over bone conduction, and that basically those 3 tests show that her cranial nerve 8 is intact. Okay, next cranial nerve is 9 and 10. Okay.
Okay.
So what I want you to do, go ahead and open your mouth as wide as you can. All right. All right. So gag reflex is intact. Go ahead and swallow for me. Patient's able to swallow. Speech is clear. There's no abnormalities in the vagus nerve or the glossopharyngeal nerve, which the uvula stayed midline. It rose and fall with swallowing. And for the next one I'm going to test is cranial nerve 11, which is your accessory. What I want you to do is, first we have equal shoulder, equally bilaterally. Can you shrug your shoulders for me? All right, good. Go ahead and relax. Show she has good strength in her shoulders. Go ahead and look to your left, push back. All right, good. Go ahead and look that way, and now push back the other way. Good. She has good strength in her neck. This basically confirms the accessory, spinal accessory cranial nerve. The final one is the hypoglossal cranial nerve, which is cranial nerve number 12. The way we test that is I'm gonna have you stick out your tongue. Tongue is normal, no fasciculation. The tongue is also pink, dry, moist, which is also normal. Go ahead and put it back in. Can you, there you go. You're there, perfect. All right, so good equal strength in the tongue, which confirms the cranial nerve number 12, okay? Next test I'm going to do is have you stand up. Go ahead and close your eyes. And you guys stay here for about 20 seconds. First, we're going to test her with her eyes open to see if there's no swaying, and obviously in her, there's no swaying. Go ahead and when she close her eyes, there's no swaying. You want to do this for about 30 seconds. An abnormal test would be inability to maintain her on balance, okay? The next test I'm going to do is a gait test where basically, can you walk over there and walk back? All right, normal, steady gait. Now when you come back, can you do heel to toe for me? There you go, heel to toe, heel to toe, heel to toe. So heel to toe was normal as well. There was no obvious imbalance as she walked. She had good balance. Go ahead and have a seat back. And what I'm checking is like your cerebellar function. It's kind of like a neuro test. Do me a favor, sit back and take your right heel and rub it down your left shin. All right, now switch and do it the other way. All right, good. All right, so basically what I want you to do is touch your finger with this finger to your nose. Back, back. All right, fast you can. All right, switch hands. Good. All right, good. And now also I want you to touch every finger to your thumb as fast as you can. Good. And her speech is coherent, and she has good, and now I want to check your grip strength. Very good grip strength bilaterally. And what I also want you to do is close your eyes for me. Hold out your hands. All right, so can you tell me what I'm drawing in your hand?
An 8.
All right.
An 8.
All right. And what I'm gonna do is put a couple objects in your hand. I want you to be able to see if you can identify them, okay?
Can I watch?
All right.
Okay, sunglasses?
Yep. All right. So stenosis and graphia, you're fine, are both normal. This basically confirms the neuro exam. I do want to go ahead and let you lay flat one more time. Now put this over here. All right, I am going to take your shoes off, so my apologies for that. Go ahead and relax your feet straight out. All right, and basically what I'm doing now is Can you just bend? This is for show. Basically what we're doing now is checking. She is a little ticklish, so we're checking the Babinski. She has a good Babinski reflex. So go ahead and set up for me. So neurologically, everything's intact. And now we're gonna do the deep tendon reflex, where I'm gonna check the brachial. Go ahead and relax your arm. All right, and do this one. All right, and now we're gonna do the brachioradialis. All right, and from here, we're gonna do the tricep. The tricep. All right, and one more time. All right, and so what we're looking for in the deep tendon is just the reaction to it. Hers was +2 in all. Usually abnormalities in the deep tendon reflex is it's hyperactive, which means it like flails like this, or basically doesn't move. It's just kind of like drooping with no movement whatsoever when you hit the nerve. Next, I am gonna go ahead and relax your legs. What I'm gonna do is test her patella tendon. All right, and then the last one is the Achilles. All right, so basically the patella and Achilles, like the upper, are normal. 2+ in the patella and the Achilles, which is normal for deep tendon reflex. All right, so now we can move on to the musculoskeletal, okay? So what I'm gonna do is get you to stick out your arms as far as you can, rotate them this way and rotate them back, go over your head, and then back out, and then in, all right, and then back out. All right, can you put your hands straight out for me? And can you put your hands behind for me? All right, so she has good range of motion in her shoulders. Do me a favor, stick your arms out, close your eyes for me. And right there, I was checking for a rebound phenomena, which was positive. Don't let me push your arms down. All right, and don't let me pull your arms up, good. And she has good strength, both shoulders +5 bilaterally, equal as well. From here, I'm going to go to the elbow. So what I want you to do is basically push your, don't let me push your arm towards you, so push it out as I push in, good. And now the same way, good, now you can relax. Go ahead and do the same thing, and we'll push this way, and don't let me pull it out. All right, so basically, can you stick your arms up like that? Rotate your elbows down. All right, and now rotate, put them beside you, rotate them out and in. Good, she has good range of motion in her elbow. Kind of make a muscle, like a curl and relax. So she has good range of motion in both bilateral elbows, +5 in your elbows, which is good, means good strength, okay? Next is your wrists. What I want you to do is flex your wrists all the way down, pop them back up, and then out, and then in. All right, so basically don't let me push your fingers back, all right, and then push them down, don't let me push them up. So wrist-wise, she has good range of motion again in her wrist. She has strong, equal strength, 5 out of 5 in those. What I'm going to take a look when I'm up here, just look at your capri feel. And nails are well manicured and properly trimmed. Good capri feel, less than 3 seconds. Again, skin's warm, dry, and intact, and everything equally on both sides. At this time, I'm also going to palpate your joints, which are your shoulder joints, your elbows, and your wrists. No swelling, no fluid noted, no heat, or no obvious deformity noted in any of the joints in the upper body. So from here, we're going to move to your lower body, okay? So basically, go ahead and lay back down for me. Alright, so from here, we're just gonna extend your leg straight up, back down, switch legs, straight up, back down. Alright, can you bring your knees to your chest? Alright, so she has good hip movement. Any pain there? Good hip stability. And from here, I'm palpating the knees and the ankles, and I feel no obvious deformities or heat or redness there. The next couple of tests I'm gonna do is just testing for the collateral ligaments of the knee. The drawer test and the Lachman's test is a test ACL, which is basically where I put a little pressure here, and here we don't want a lot of movement for the joint, and she has obviously endpoints, which are good. So those are the tests, the knee mobility. All right, one more test. I'm gonna get you to stand up for me. And touch your toes. Any pain when I palpate here?
Mm-mm.
All right, so she has no pain upon palpation. She has good frontal. You can go ahead and stand up. Go ahead and arch your back as far as you can. Good, she has good mobility there, side to side. Yeah, like this way, and then that way, and then twist. So spinal mobility is completely intact, normal, equal, no step downs, no scoliosis noted, no lordosis or kyphosis noted as well. She stands equally with her shoulders, hips, and knees completely equal, not off center. That ends our head to toe assessment. Thank you.